All right. Well, I have 10:33 by my clock, and I'm going to go ahead and get us started. I see other people are getting on now. We'll start with just some introductions. First, I'd just like to formally thank everyone. Thank you so much for joining us. Before we get started today, I want to take a minute to recognize our collaborators on the call today. First, from our parent organization, the Ounce of Prevention Fund, we have our communications director, Jennifer Hartshorn, with us today. Jennifer will be helping me facilitate this conversation, responding to your questions, helping me with technical issues, and as she is a communications expert, help me communicate. Also, today we have my colleague in the Prevent Child Abuse Florida office, Ms. Nydia Intuda. She's our Circle of Parents training specialist and an invaluable member of the Ounce team. Thank you for being with us this morning, Nydia. Jennifer and Nydia will both be helping us respond to questions, and whatever you need, they'll be doing their best to assist you. We're also getting part of the band back together today. If you were with us for any of the earlier webinars back in April, you got to meet Mr. Zach Gibson. Zach is Florida's Chief Child Advocate and the Director of the Office of Adoption and Child Protection in the Governor's Office. Thank you, Zach, for joining us today. I want to take just a minute to talk tech. So as I was mentioning, as people were getting on this morning, sometimes this platform takes a few minutes to get your speakers working and sync. So if you're experiencing any technical issues, please let us know. You can call in on the audio number that you see there, 1-866-901-6455. And the PIN is also there. That's 800-394-960. Thank you again for joining us. Today's webinar, we're going to be focusing on what we commonly refer to as public awareness. We're going to talk about it, of course, as it pertains to the prevention of child maltreatment. And most of you know that our mission at Prevent Child Abuse Florida is to prevent the abuse and neglect of Florida's children, just as Prevent Child Abuse America's mission is to prevent the abuse and neglect of the nation's children. We're extremely proud to do this work, and there's literally no way we can do it without all of you. In fact, as the new president and CEO of Prevent Child Abuse America, Dr. Melissa Merrick, is fond of saying, prevention only happens in partnership. We recognize that. I think many of you have seen and worked with us and helped us get out the information that we share in various forms. We appreciate you doing that. There's no way we could do without you. Thank you for helping us throughout the years. I want to also direct your attention to the two handouts for today's webinar. One is called the Prevention Framework. Zach will be going over that shortly. The second one is called PCA Florida Resources, and we'll be referring to them throughout today's presentation. But before we get started, I'd like to talk for just a minute about my personal journey toward prevention land, as I call it. So before many of you were born, I was privileged to work as a child protective investigator starting way back in 1989. And as a CPI, I now know that my coworkers and I were practicing what we would call now self-care. We relied on each other for support. We had group meetings during the week. And I can say, really, we were practicing self-care before it was cool. The point is that now, 30 years later, I've been lucky to make a couple of trips through prevention land, as I call it. And it was through my work with Healthy Families Florida and in the Office of Child Welfare at the Department of Children and Families that I experienced my epiphany and began to realize that we always came back to those same things that we said way back in our support group meetings in the late 80s and early 90s. It was true what we said then. We said, you know, every case we discussed, it almost always came back to saying, it's too bad that we can't do something to stop all this abuse and neglect before it starts. If this parent had just had a bed for her children, if this parent had just gotten the mental health treatment that she needed, if this family had just gotten this resource, then we would have not seen this family. We might not have even come to know this family through our system. So we can all prevent abuse and neglect. We do that by supporting families, giving them the education, the tools they need to raise their children in healthy ways, to have healthy families, and to live in healthy communities. And to get us started today, we're going to get a primer on the 3 categories of prevention. And I couldn't think of anyone better to introduce those to us than our friend Zach. I mentioned Zach's Florida's Chief Child Advocate. He is a child advocate. And as such, he's a member of Florida's Children and Youth Cabinet, led by our First Lady, Casey DeSantis. Zach provides technical support for the cabinet, and he's been instrumental in the adoption by the cabinet of Florida's prevention framework. I'd like to turn it over to him now to go over this framework and prime the pump for the rest of our conversation today. Zach, take it away, my friend.
Thank you, Chris, and good morning, everyone. Thank you so much for joining us today. A lot of great stuff. I first want to take a moment to acknowledge the work of Prevent Child Abuse Florida. The team over there has done some amazing work, and if anybody has ever participated in our Pinwheels campaign, the Pinwheels for Prevention campaign, you will know that it has certainly evolved and continues to refine, improve, and strengthen its efforts every single year. So I want to definitely take an opportunity to acknowledge the work of Jennifer, Nydia, and Chris for their leadership and for their willingness to put forth these efforts, because it's all about supporting the partners like you. As Chris mentioned before, prevention doesn't happen without partnership, and you guys play critical roles. So we're so thankful that not only you joined us today, but that you value the importance of prevention through your work every single day. So, you know, Chris mentioned the 3 categories. I talk about them as 3 levels of prevention: primary, secondary, and tertiary. Many of you are very familiar with these. We are going to be talking about it from a lens of child maltreatment. And of course, when we think about primary prevention, we're talking about stopping things before they even occur. And we look at it from a very universal perspective, the role that the public plays, that every individual plays beyond, you know, whether or not there's systems involved or not. This is everyone. We want everyone to get the education, the training if needed, so that they can be empowered to put that into action. And quite honestly, never have to worry about them at all, right? That if anything, we can go to them for support, and they can assist in sharing their knowledge around whatever it is, particularly around child maltreatment, around supports, resources, protective factors, another good term that many of you are familiar with, that can be built within families. Secondary prevention is where we really target this, and I look at secondary from a 2-lane perspective of being community involved and then systems involved. Secondary encompasses both of those populations, and certainly for the work that we are trying to do, we focus more on the community lens so that they never become systems involved. So we think about our efforts as being more targeted, and then with tertiary, we know that our primary and secondary prevention efforts definitely complement and support the work of our agencies as they work to prevent additional maltreatment from occurring again. So again, very focused, very targeted. And again, when you look at all 3 levels of prevention, they all complement one another. And certainly our focus today is really building upon our primary and front end secondary prevention efforts as it relates to child maltreatment. Our next image that you're going to see here is the prevention framework that Chris mentioned from the Florida Children and Youth Cabinet. This is a handout in your little toolbox there. So if you haven't downloaded it, please do it. Chris has also provided a link to where you can download it from the actual cabinet annual report. This image, this prevention framework was included in the report because certainly the First Lady has a big focus on prevention. Her Hope for Healing initiative has continually gone around the state to emphasize the importance of awareness, of resources, but more importantly, for folks to take advantage and access those resources. There's no doubt that we would rather provide services and supports to you before you become involved in our systems, because when you become systems involved, you know that our systems are very complex, and sometimes the coordination of additional supports can be a little more challenging. So again, our focus is really on how do we get you on the front end. And as you look at the visual here, based upon what pathway you may be on, how do we get you on the pathway that moves you towards becoming productive and self-sufficient? So real quickly, if I could just go over this image, you see there at the top, productive and self-sufficient. This is something that each of our agency systems at the state level and even down to the local level, generally speaking, we're all working towards this because we want everyone to become productive and self-sufficient, because we know by doing so that you're not being involved in our systems. Again, you look at the pathways because there's multiple pathways that people may be on, and certainly when we encounter them, our goal is to meet them where they're at. So no matter where they may be on this their pathway, our goal is to say, based upon where you're at, how do we help build opportunities, provide supports, access services that can continue to move you on a pathway towards becoming productive and self-sufficient. I want to transition your eyes to the bottom of the page to the word transition, because transition is, while it may be at the bottom, is an integral part along this continuum. And it, transition happens throughout every stage of a person's pathway towards becoming productive and self-sufficient, particularly when we are accessing services, we may be in systems involved. You know, there are key transitional points when we talk from one system to another that unless that is nice and smooth and information is being shared, that's where challenges can certainly come up. So that's why transition is highlighted in this prevention framework, because it's such an integral part of the work we do. Additionally, you will see 4 strategies, and these strategies are very general, very broad, but I think at the same time also specific to the work that we are all doing. When it comes to primary prevention, we certainly want to emphasize education, and I would even argue that I would even expand that to say education and training. The work that Prevent Child Abuse Florida has done as it relates to the resilience screenings that hopefully many of you are familiar with has been so helpful in further creating understanding and awareness of adverse childhood experiences. The film provides a perspective as it relates to what happens when your system's involved or accessing services, particularly through home visiting. But more importantly, that even though we may have ACEs, it's not the end of the world. We can overcome this. And certainly as it relates to parents with young children or children altogether, their relationships, the roles that they play are integral in promoting their healthy development of their kids so that they can successfully transition to adulthood and certainly become productive and self-sufficient. As you look at the middle of this framework, you will see the 3 levels of prevention that we talked about earlier, as well as information related to risk and protective factors. Now, many of us are very familiar with risk factors because we talk about them all the time, but yet there's been a growing movement of really focusing more on protective factors that really speak to how do we mitigate these risk factors that further promote an individual's ability to be on a pathway towards becoming productive and self-sufficient. So again, The idea for the introduction of this model is to create a universal view to guide our discussions. Many of us, when we are within our agencies, we talk about all this stuff, right? We're trying to figure out, how do we get this person on a pathway towards becoming productive and self-sufficient? So from an individual perspective, this helps in guiding our discussion, but it really too really supports our interagency work, as many times we may be in one agency, but we have to work with another agency to access services or supports or what have you. And this again provides that view, that universal view, to help guide our discussions to figure out, the strategies that we need to enable people to be on a pathway towards becoming productive and self-sufficient. So again, we wanted to share this with you. This is going to be at the core of the prevention work. Certainly my office focuses on, but certainly the work that we do in supporting the Prevent Child Abuse Florida, and all of our state agents, but more importantly, the work that you do at the local level. All this may sound great, but unless our efforts at the state level are working directly to support your work, none of us will ever achieve our outcomes. So this is really critical to supporting the work that happens at the community or local level to enable you guys to be successful, so that we can all achieve the outcomes that we're charged with, but more importantly, that people certainly become productive and self-sufficient. All right, so primary prevention, as you see right here, front-end work, universal. It's a set of strategies and programs designed to stop maltreatment. There's so many different things that we can do, and really, I think we can all be very creative in thinking about our primary prevention efforts. We do a lot of work with public awareness, hence the title of today's webinar is the governor issues proclamations, agencies issues press releases. These are all things to help communicate messages about the issue, but more importantly, focusing on what can we do to mitigate the risks associated with that. And again, when we look at it from a universal perspective, we want this information to get out to everyone. So when we transition from primary to secondary, we now focus more on a targeted approach, right? Maybe high risk and offered to populations that have more than one risk factor. There's a variety of different strategies here that are outlined. But again, when we think of secondary, we look at it from a community involved perspective as well as a systems involved perspective. I know Chris is going to talk a little bit about the Families First Prevention Services Act. Prevention is talked about a lot in there, but we think about it along the prevention continuum. We look at it really from a secondary systems involved perspective, and the work that we are doing is designed to complement and support the work of the department and of other agencies as we continue to work those individuals to get out of the system back into the community and certainly be on a pathway towards becoming productive and self-sufficient. And then lastly, we talk about tertiary prevention, right? We want to prevent abuse from occurring again because we know it's already occurred. And again, there's a variety of different things that are out there. One of the biggest things that I think a lot about is regarding support systems, right? That is many times a key difference in people's lives that help them overcome the stressors and the challenges that they may be faced with, but more importantly, help build the resilience that's needed so that they don't put themselves in that situation, or if they are in that situation, they can hopefully better manage that situation more effectively. But more importantly, support systems are at the core, and I think with tertiary prevention, this is really a key component of that. Whether it be the work that our foster parents do day in and day out of taking care of kids who are involved in the child welfare system. We're so grateful and thankful for the work that they do. The role that folks play even in juvenile justice. I mean, I think we can look at the whole continuum of our systems to recognize there are so many great efforts taking place that are designed to prevent abuse from happening again, but more importantly, really working to build the skills, the knowledge. Sometimes we talk about rehabilitation, but in many cases, we're really focused on habilitation in the sense that these aren't things that we're trying to reteach. These are skills and knowledge about things that they've never heard before, never experienced before, that we are providing to help build their knowledge and ability to be successful. So again, the 3 levels of prevention are primary, secondary, and tertiary. All play a critical role in the work that each of us does within our state in an effort to put people on pathways towards becoming productive and self-sufficient. Please consider utilizing this model, this framework, as you have discussions with members within your team, within your organizations, with the interagency work that you do, so that it again puts us all seeing things from a similar lens and guiding our discussions around the roles that we can play to help people become productive and self-sufficient. Thank you, Chris.
Thank you, Zach. And I just want to take a minute before we keep going to share a little bit about our conversations and something that you and I talk a lot about, and that is when we provide education, when we provide secondary and tertiary prevention services, we're also helping the next generation. So in many ways, we're really doing 2 or 3 of the types at the same time. And I know that's something we've talked a lot about.
Absolutely, Chris. Thank you for sharing that. I think that's a easily overlooked concept when we think about prevention, right? Is that the work we are doing now is not only designed to help the person who's in need, but it also has the ability to impact future generations.
That's right.
Again,
Yes.
whether or not we are going to see the benefits of that immediately or ever at all, I think many times if we never hear back from these families in the future, we know that hopefully some of our work has been impactful.
That's right.
But again,
Yes.
I think your point, Chris, yeah, the work we are doing around prevention certainly has greater benefits beyond what many of us will ever see. So
Yes.
thank you again, Chris, for the work that you and your team are doing, and certainly for everyone for the work that they are doing related to prevention.
Yeah, no way we could do this without everybody on this call. Prevention does happen in partnership, and you're a great one. Thank you, Zach. I appreciate that overview that Zach just gave us. And Zach, I appreciate your knowledge, your perspective. I want to transition now to talk about primary prevention. And I'll just add to what Zach and I were just saying is that prevention, I think we should look at it as an investment. And a lot of investments, you really never get to see the results immediately. Sometimes you can, but this would be a long-term investment. This would be an investment in the future of our country, an investment in the future of our state, an investment in our children, an investment in our families, an investment that we can make to be able to save money in the long run. And there are a lot of studies that are out there that talk about the money that we spend on the kids who come into foster care, for example. A lot of the money that we spend on services that we provide after the fact, and how much money we could save by investing in more prevention programs. And I'll talk more about those certainly before we get to the end. First, though, I do want to talk a little bit about public awareness, or what you could call universal prevention, primary prevention. These are services and techniques that are used that target all members of the community. All members of the community have access to these services. All members of the community can benefit from these services. So what we're talking about when we talk about public awareness is we're seeking to raise the awareness of the general public, and that's all of us, but also service providers and decision makers about the scope of problems associated with child maltreatment. And so much of this work does center around parent, or I'll say caregiver education. It usually features things like public service announcements. And you know, we certainly have those. It talks about parent education. We talk about those. We have our Circle of Parents model. That is a support group model, and I'll talk more about that. But it's also in an effort to help everyone realize that an effective campaign has to be what I would call multimodal to be able to reach its greatest level of effectiveness, like our Pinwheels for Prevention campaign. We follow that model. We have public service announcements, but we also provide parent education materials in the form of our caregiver guides, our advocacy guides, and all the materials that you are probably all familiar with. If you're not, I'll certainly be giving you the information that you need to be able to find those before the end of our presentation today. We partner with local agencies that are interested in starting parent or caregiver support groups through that Circle of Parents model I just mentioned. We provide all the startup training. We provide all the materials that people need. We train the facilitators. We train everybody who's there, who is a part of the program. And I like to say that if the janitor's around, we want to train him or her. If the person at the front desk is available, we want to train her or him, because we want parents who show up, and y'all know how it is. People don't always take these things and store them away, and some of us have a little more problems with our memory now that we may be over 29, like some of us are. So if someone shows up at the front door, we want the person who greets them to be able to say, if they say, I'm here for that circle thing, we want them to be able to say, thank you, sir. Thank you, ma'am. Yeah, we appreciate you showing up. You're talking about the Circle of Parents program, and I'll be glad to show you to where you guys are going to meet tonight. We're really glad to have you show up. And I just want to say that we can offer all that at no cost. Now, we can't be there. There's 2 of us. There's 67 counties. So what we have to do, I said this happens in partnership. What we have to do is we have to partner with a local agency to be able to do this. And we can do that thanks to our grant from the Department of Children and Families that sees the benefit and sees the importance of investing in these types of prevention services. And to be able to help illustrate my point, I'd like to invite all of you to take a trip back in time with me. Some of you are old enough to remember way back in 2007 and what our state's role was in the tobacco lawsuit that resulted in a multi-million-dollar settlement with that industry. And Florida was able to use those dollars to run a very effective ad and marketing campaign that was focused on getting people to quit smoking, but also focused on stopping youth from ever starting. Some of you may also remember prior to 2010, when all of this was going on from 7-8 to 2010, when you walked into a restaurant, sometimes you had to navigate your way through the smoking section in the restaurant to get to the non-smoking section. And it was also very common to enter a smoky lobby of a hotel or an office, or to smell the strong scent of tobacco in your room, and lots of other public places. So this campaign was very successful. In fact, it saved the state $3.2 billion, that's billion with a B, dollars annually in healthcare costs. See what I'm saying now about the investment there? Up to this date, it's estimated that this one smoking cessation campaign and smoking prevention campaign has saved us over $17.7 billion as a result of fewer adults smoking. The conclusion then is that statewide media campaigns work, and we can use those materials to affect population level change. They can be used to do something that we've talked about before, and that is to change norms, to change behavior. And that's one of the things that if you've tuned into any of our previous webinars, or if you've seen them on the website, you know we worked with our partners down in the heartland of Florida, so to speak, Heartland for Children, on their social norms campaign. That's a big part of our Pinwheels for Prevention program, and you can find all those, by the way, on our website, preventchildabusefl.org. Don't forget the FL, and you'll find those under the Pinwheels for Prevention tab. So when we seek to change behaviors, we use these campaigns to try and change our thinking. We have to start there. We have to change our thinking. And one time I had a teacher who said, Chris, you got to change your stinking thinking. You got to look at this in a different way. So this is what we seek to do. You can make the argument that abuse and neglect of children is certainly more insidious and a societal ill than smoking was, than smoking has been. So it stands to reason that our efforts to change this type of behavior will take longer. It'll take more effort in this regard. And one of the ones that I wanted to start out with, because October is Safe Sleep Month. It's known by a couple of other names, but we use this month to talk about what we call the ABCs of safe sleep. We know babies, children, sleep the safest when they're alone, on their back, in a crib. So those are a couple of the places where you can go and find resources. The governor also proclaimed October as Safe Sleep Month in Florida, and you can find those also in our handout, PCA resources, and you can use the live links there. This PowerPoint slide presentation will also be on the website, as I mentioned, and of course our contact information will be on the slide at the end. So we use public service announcements. We've worked with Department of Children and Families. There are several that you can access. I hope you'll use these. I hope you'll share them on your social media pages. They're going to help us drive home the message and say it in lots of different ways and talk about the ABCs of safe sleep. In fact, I'll take just another minute to talk about some local efforts around the state that have amplified this messaging and tailored it to their local population, using research and evaluation to educate parents and children, or parents and caregivers in their area. And one such initiative that I'll bring up is called the Sleep Baby Safely campaign. And it's led by the Juvenile Welfare Board of Pinellas County. And it's shown some really promising results. So much so that, in fact, it's now expanded into Northeast Florida. And of course, it focuses on preventing the suffocation of infants due to co-sleeping or unsafe environments, unsafe sleep environments, and what are sometimes called rollover deaths. Other partners as well, like the Children's Services Council of Broward County, they sponsor campaigns that focus on the leading causes of preventable child deaths, like unsafe sleep and drowning. And speaking of drowning, we also have a water safety toolkit. We have public service announcement, again, thanks to our partnership with the Department of Children and Families, but also we have partners at the Department of Health that I want to take a minute to say thank you to. And we have materials that you can find, just like I described for the others. We have bath time safety magnets, since kids don't just drown in pools or other bodies of water. They also drown in bathtubs and sinks when they're getting baths and are left unattended. So what I would say about water safety is supervision is the key. Supervision is part of the 4 layers of protection. And if you're interested and want to know more about that, I'll be glad to provide you with more information. We have great partners all around the state that are working to make this happen and cut down on the number of children who drown in our state every year. Unfortunately, we're right there neck and neck with states like California that have a huge coastline, and all too often we lead the nation in that not desirable category of drowning deaths of children. We also have, again, thanks to the Department of Health, the Safe Kids program. We have Josh the Otter books and activity sheets available for order on our website. You'll find that link on the PCA Florida resources page as well. And the main campaign that we're known for, and Zach mentioned it a minute ago, is the Pinwheels for Prevention campaign. I know a lot of you are familiar with this. I just don't think too many people can be familiar with it. We want everyone to know about it. We want everyone to be aware of the resources that we make available every year, like the toolkit that we develop and make available, again, with our partners at the National Office of Prevent Child Abuse America. And that is a really quick overview of 3 of the quote unquote campaigns that we do. I'd be glad, again, to provide you with more information on any of these, and my contact information, if you don't already have it, will be available at the end on the last slide. I also, though, want to take a minute to talk about the future. Zach mentioned earlier the Family First Prevention Services Act. It might be families, I'm sorry if I messed that up, but it was passed and signed into law back in 2018. You can go to this link. You can find more information about Families First by Googling it, of course. You can see this link here, and we'll be posting this PowerPoint, like I said, so you'll be able to access it that way. But you may not be familiar with the basic tenets of the Families First Prevention Services Act, or with the person I consider to be the main spokesperson for this act, Dr. Jerry Milner. I'd like to share with you for just a minute a little bit of a letter that Dr. Milner posted on the Children's Bureau website. You can find it there. You can find a lot more information, a lot of interviews with him, where he takes an opportunity to hammer home this message that we have to invest in prevention. We really don't have a choice. This is one of those things where if you do the things you've always done, you'll get the results that you've already got. And right now, I know no one wants more children to come into foster care. We want to reach these families before they ever come to our attention. Oh, and by the way, some of you who are on the call, or some of the folks in our area and in our partners out there all over the place, you know that I'm a native of the state of Alabama and a true Crimson Tide fan. And I'm sorry to all you Gators and Seminoles out there and Hurricanes, but I'm very proud to tell you that Dr. Milner is a fellow Alabamian and a graduate of the University of Alabama. But more importantly, he's a true champion for children and for supporting parents. Dr. Milner, I won't be able to tell you his whole story, but he comes to this work naturally. He had occasion to experience his community's support of his family, and he's benefited from that greatly. But what we really want to do, like I said, is to keep people from ever coming to our attention to start with. Some of you have heard the analogy of prevention described as a contrast between building a hospital at the bottom of a cliff or building a guardrail at the top of the cliff to keep people from falling off and getting hurt to start with. But I think Dr. Milner's words have great meaning, and I'd like to share a couple of excerpts from one of his letters. So you can see a description here of Dr. Milner. He's a tremendous champion for children, as I said, and these are some of the words that he has used. Like I said, I'll take this straight from the letter that he wrote. He said, imagine with me for a moment what the world would look like if the public health system's major strategy to combat a serious illness or disease like polio was to invest in wheelchairs and crutches for patients after they got ill, instead of investing in vaccines to prevent illness. Imagine if car makers invested in jaws of life and ambulances to get victims out of mangled cars and get them to hospitals faster. And that was their primary means for addressing automobile safety, rather than having seatbelts, airbags, warning systems, and other safety features to help prevent those injuries from happening to start with. Imagine if our primary way to deal with baseball or football or any other sport injury was to buy more ice packs, more neck braces, slings, whatever, you get the point, as opposed to requiring players to wear helmets and shoulder pads. He also said, we must see the inherent value in preventing trauma and aggressively prosecute or tackle or address its root causes. And I want to pause on that one because I really believe that this is at the heart of our success, is being able to attack the root causes of trauma. The root causes are often linked to what Zach mentioned a few minutes ago when we show and when we talk about the resilience film and the importance of one caring adult and how much difference that person can make in the life of a child. We're not just saying that, it's actually proven science. So we can create conditions for strong families that thrive. Where children are free from harm, we can demonstrate that children are safer when families thrive. We can, they are. We can, and we will show the power of community in supporting families and keeping them healthy and well by making a national commitment to well-being that's grounded in thriving families and safer children. And I wanted to just point out one last paragraph of Dr. Milner's letter to the nation, because he pointed out some examples of very effective, very well conceptualized and programs across the country that have already been implemented that are based on community-based primary prevention. These programs include family strengthening approaches and working to keep families strong and intact. And some of them are mentioned here: Live Well San Diego, the Harlan Children's Zone. And I want to also add that we at the Ounce of Prevention Fund also support programs that are modeled along the lines of some of these, especially the Harlem Children's Zone. There's also, though, others like the Center for Family Life in Brooklyn, Communities of Hope that's funded by Casey Family Programs, that, by the way, have now partnered with the Children's Bureau and Prevent Child Abuse America to roll out a new initiative that's called Thriving Families. So I'll be sharing more about that with you guys in the near future. But he also went on to talk about specific county initiatives. So you can Google these and find out more about them. The one in Allegheny County, Pennsylvania, Jefferson County, Colorado, Los Angeles County is huge, as you know. So we can have successes like this on a local level, and we can move these things that we learn out and implement them in other areas or across the country. We really can make a difference. And in fact, as Dr. Milner summarizes, we would be remiss not to learn from these examples and not to do all that we can do to bring this primary prevention approach for maltreatment, to prevent family separation. We gotta bring it to scale on a state level, on a federal level, and make child welfare a priority. So I hope you all see that we have a lot of support on a national and state level. And I'd just like to offer a little bit more information before we go to questions. I'd just like to say that we appreciate all of you who are attending these webinars very, very much. I really believe that, as Dr. Merrick says, that the only way we're going to be able to do this is by working with all of you. We're small, but mighty, I like to say. So we're always going to be willing to listen to you, to work with you, to look for opportunities to collaborate, as we're doing with several of you now. We have some really cool initiatives, some really neat things that we're doing, and I'll be talking more about those. I want to add one more thing, and this is more of a request. So we've recently migrated our email to the cloud thanks to COVID. It's actually been a silver lining though, because it was really a good thing. It was time that we did it. But it's possible that we lost some email addresses and some contacts. So please share this information and help me get it to everyone so that they can all join us in our partnership. And I appreciate you all attending very much. And I want to now give us time to be able to respond to some questions. So I'm going to ask Nydia and Jennifer if we have hands that are raised or questions that have been chatted in.
Hi there, everyone. I guess, all the information has just been perfect because I don't see any questions at this time or comments. If anyone does have any questions or comments, it's not too late. You could go ahead and put them there in the question box. But at this time, I don't see any.
Well, thank you, Nydia. I appreciate that. That tells us we did a really good job, or people are really shy, one or both. Jennifer Hartshorn, I wanted to give you an opportunity to add anything you would like to add.
Well, I think we're just grateful to everyone who's on here for taking the time to listen. I know that many of you are active in our campaigns year round, and to some of you, this is not a lot of brand new information. Some of it is, but just thank you for all that you do to help with the messaging and for your partnerships. And Chris and I didn't talk about saying this, so hopefully he won't be upset when I do, but we also have a new Facebook group called Florida Partners for Prevention.
Oh, yes, thank you.
That's just another place where we can all collaborate with prevention messaging, resources. We'll be posting things like the resources that you've gotten today, like the sheets that Zach showed, the charts. And it's just the Facebook group allows a more collaborative opportunity. So instead of you receiving a newsletter from us where you just read the information, or receiving something on our Facebook page, it's a place where we can all talk about here's how we're using it, or if we have a resource and you have something that would complement it, then you can share that with the group. So we hope you'll all seek us out on the Florida Partners for Prevention page. If you're having trouble finding it, then email one of us and we can just send you the link. We'll also continue promoting it on communications that we send out from the office through Chris's email and through our regular Facebook if you are watching that page.
Thank you, Jennifer. No, I'm really glad you brought that up. There's always challenges with communication. A lot more filters that are looking for junk email, especially when you're sending it to a lot of people and trying to get the information into as many people's hands as possible. It certainly takes some doing to be able to keep up with everybody. So I really think that that's one of the things that we can do to help make that information more available. I do see a couple of questions that have come in now. One person is asking if we can put the links in the chat. I'm hoping that Jennifer or Nydia might be able to start working on that now. And I'll go ahead and answer a couple of the other questions. One from Timothy, who asked about putting the link in the chat. Timothy, these slides will be available on our web page. That's preventchildabusefl.org, and you'll find it on the left-hand side under Pinwheels for Prevention link. Jennifer, is there anything else I should tell her? Let them know about that, or I know you're probably busy typing. So I'll go ahead and just answer one more. I just want to say that we so appreciate everyone tuning in, but also sharing this information because of what I was just saying. If you have any trouble finding any of this information, I'll put our contact information. I'll go ahead and put it up on the screen, and we can be reached at our email address. Mine is clolly@ounce.org, or you can reach Nydia at nintuda@ounce.org, and there's our cell phone numbers if you want to call us. We're in and out of the office now, but I will also be able to communicate with you that way. I see a question about whether we will have certificates. We do those by request. So if you'll just email me at clolly, don't forget the E, @ounce.org, and request a certificate, I'll be glad to send you one. So yes, we will have certificates available. So I'll be glad to send you one. Any other questions, Nydia, Jennifer, that you see? Doesn't look like. Okay. Well, I'm going to go ahead and give people back 30 minutes of their lives, and say that we appreciate so much you all tuning in today. Like I said, call us, write us, let us know if there's anything else that we can give you, provide for you, and keep up those efforts on the local level. Let us know how we can support you. And I'll just close with this, unless there's any other questions. I'm clicking on it now to see that Jennifer has put in the main link to our web page, and I'll give you Nydia's other cell phone number that she will be able to reply quicker on, and that would be 786-505-8094. I'm sorry, I think I may have put the wrong cell phone number in there for her, so I'll change that before we post these slides on the website. The last thing I'm going to say is keep it up, and remember, let's pay attention to prevention. Thank you all so much for joining us. Have a good day and a good rest of your week.